Good evening, everyone. I am Snehal Tarte, and today I am explaining the cardiovascular system. The cardiovascular system, also called as the circulatory system, is responsible for the transport of blood, nutrients, gases such as oxygen and carbon dioxide, hormones, and waste throughout the body. There are three main parts of the cardiovascular system. They are heart, is the muscular pump, blood vessel, network of tube, blood, the circulating fluid, structure of the heart, location of the heart is in the thoracic cavity between the lungs, slightly tilt to the left. Size is the about the size of fist, 300 gram in adults, covering pericardium, double layer sac that protect and anchors the heart. Chambers of the heart are right atrium, receives deoxygenated blood from the body. Right ventricle pumps it to the lungs. Left atrium receives oxygenated blood from the lungs. Left ventricle pumps it to body. Walls of the heart. Walls prevent backflow of the blood. Wall are a tricuspid wall between RA and RV. Pulmonary wall at opening of pulmonary artery. Mitral as well as bicuspid wall between LA and LV. Aorta valve at the opening of aorta. Blood circulation pathways. There are circulation pathways such as pulmonary circulation, right side of the heart. Deoxygenated blood goes to the RA, then tricuspid valve, then RA, then pulmonary valve, then RA artery, lungs, and then oxygenation. Systemic circulation, left side of the heart. Oxygenated blood, lungs to the pulmonary wall, veins to the LA, then mitral wall, then LV, then aortic wall, and then aorta, and then the body tissues. Blood vessels, arteries carries blood away from heart, mostly oxygenated except pulmonary artery, and the structure is thick and elastic walls. Then veins carry blood towards heart, mostly deoxygenated except pulmonary vein. Thin walls present, and then capillaries connected arteries and veins, exchange of gases, nutrient, and waste, and their structure are one cell thick walls. Then cardiac cycle, one complete heartbeat is equals to contraction plus relaxation of artery and ventricles. Phases are arterial systole, arterial contract, blood into ventricles, ventricular systole, then ventricle contract, then blood into arteries. Diastole, relaxation, chamber refill, duration is 0.8 seconds per cycle, about 75 beats per minute. Heart sounds are lub and dub. Lub are SA, closure of atrioventricular valve, that is tricuspid and mitral. Then dub S, that is S2, closure of semilunar valves, aortic and pulmonary. And then control of heartbeat, sinoatrial nodes, that is SA node, pacemaker of heart, initiate impulses. Then atrioventricular node, that is AV node, delays impulses. Then bundle of His and Purkinje fiber, spread impulses for ventricular contraction. Normal rate is 70 to 75 bpm, can vary with age, health and activity. Composition of blood. Plasma is the component of blood that is 55% in the body, and its function is to transfer of nutrient, hormone and waste. Then RBCs, that are erythrocytes. They are 45% in the body and carry oxygen, contain hemoglobin. Then WBCs, that are leukocyte, are less than 1% and their function is to defend against infection. Then platelet, that is thrombocytes, that are also less than 1%, help in clotting. Then blood pressure, systolic pressure, then diastolic pressure and normal BP. Normal BP is to 120 to 80 mmHg. Then diastolic pressure is during relaxation is 80 mm per Hg. Then systolic pressure is during ventricular contraction. It is 120 mmHg. And common cardiovascular disorder, that is in that hypertension, which is high blood pressure. Then atherosclerosis, that is fat deposition in arteries. And angina pectoris, that is chest pain due to low oxygen supply. and cardiac infraction, that is blockage of coronary artery, and heart failure, inability of heart to pump enough blood,